Hi, my name is Christopher Westfall. Thanks for joining me today. Important information I want to cover about Medicare Advantage in the news. Again, my name is Christopher Westfall. I run an insurance agency called the Senior Savings Network. We're based in 46 different states now. So if you are in any of the states other than Hawaii, Washington, D.C., Alaska, far away flung places, Puerto Rico, we don't do. Everywhere else in the continental United States, we probably do. We help seniors with their Medicare plans. I've been a licensed agent for about 23 years, and this story that came out today really kind of irks me and kind of drives the point that I've been saying for years and years, and that's that Medicare Advantage plans are absolutely fantastic until you need to use them. And when you really need a Medicare Advantage plan, and that is when you get cancer, when you get a chronic disease, when you get something that's going to put you in and out of the hospital multiple times, potentially over the next couple of years. And this breakdown we see in my clients over the last 20 years typically happens around the late 60s, early 70s. That's when the majority of things start to break down. The warranty kind of expires, if you will, on certain body parts. So they have to go into the hospital frequently, it seems, in many cases. And so people rely on these Medicare Advantage plans, oftentimes when they turn 65 because they're so cheap. And as a matter of fact, they have no cost associated with them whatsoever. How do they have these plans when there's no cost? My grandmother used to tell me that sometimes you get what you pay for, and the cost is borne by the rest of the taxpayers so that they can pull you off of original Medicare rolls and put you onto a private insurance company who is then responsible for all your health care decisions, and they manage your care. Typically, when you think of management, it's cutting costs, it's keeping things low, paying the cheapest that they possibly can. And in this case, and I want to read this article to you. This is an opinion piece that I'm making today. I'm not stating anything based on fact. I'm basing this on opinion. This is my opinion of the fact. So I just want anybody to think that I'm, bashing an insurance company, because I'm not. I'm going to read you the news and then opine on the news based on my colorful background of dealing with seniors over the years. Now, this is two Medicare Advantage companies. They've settled a lawsuit in Florida, a whistleblower lawsuit, which is where the whistleblower finds something wrong. Nobody will listen to them to get anything done. They file a lawsuit, and that gives them a bunch of protections in the law. And actually, they can participate in the settlement, if there is one, when somebody is found doing something wrong. So two Medicare Advantage plans have now settled this suit, and it's big news in the Medicare Advantage space. Matter of fact, there's a lot of news coming out in the Medicare Advantage space. So let's take a look at this article real quick. I guarantee you this is worth your time. So the title of the article is, Two Medicare Insurers Settle Whistleblower Lawsuit for $32 million. Two Florida Medicare Advantage insurers have agreed to pay nearly $32 million to settle a whistleblower lawsuit that alleged that they exaggerated how sick patients were and took other steps to overbill the government health plan for the elderly. It's not that government health plan. It's a system in which the government pays the health plan. It goes on. The suit settled on Tuesday, so it was alleged, and now it's been settled. The suit was filed in 2009 by Dr. Darren Sewell, a physician and former medical director at the two health plans. He worked for both. Freedom Health, which I remember, that was in Central Florida, and Optimum Healthcare, both were based out of Tampa. The doctor worked at the plans from 2007 to 2012. He died in 2014, but his family took over the case. Now, the doctor alleged that Medicare overpaid the health plans after they made their patients appear sicker than they were, or claimed that they had treated patients for medical conditions that they either did not have or for which they had not been treated. The Florida settlement comes amid growing government scrutiny of the Medicare Advantage plans, which receive higher payments for sicker patients than those in good health. The payment formula, known as a risk score, has been used since 2004. Medicare Advantage, this is a quote, Medicare Advantage plans play an increasingly important role in our nation's healthcare market, Acting U.S. Attorney Stephen Muldrow said in a statement. This settlement underscores our office's commitment to civil healthcare fraud enforcement. Overspending tied to inflated risk scores has repeatedly been cited by government auditors, including the Government Accountability Office, the GAO, and other critics. At least a half dozen whistleblowers have sued health plans, alleging they tampered with the billing formulas to improperly boost profits. The Sewell case is among the first to settle. A lot of pending cases right now. Quote, "This is the largest whistleblower settlement involving health insurers' manipulation of their members' risk scores," said Mary Inman, a San Francisco attorney who represented Sewell. That's the doctor who filed the whistleblower suit. She said the settlement sends an important signal to health insurers that the government is serious about risk adjustment fraud. In a statement, Freedom and Optimum corporate counsel Bahal Patel denied any wrongdoing. Quote, "Although Medicare managed care is a complex and constantly changing industry in which it is common to have differing interpretations of regulations, with this settlement, we have agreed to resolve disputed claims without any admission of liability in order to avoid delay and the expense of litigation so that we can focus on providing quality care, member service, and maintaining the highest Medicare star ratings," Patel said. Earlier this month, in a related story, the Justice Department accused giant insurer United Health Group of overcharging the federal government by more than $1 billion by improperly jacking up risk scores over the course of a decade. Again, I'm reading the news, and I'll tell you the opinion here in a minute. This is an article courtesy of KaiserHealthNetwork.org, KHN.org. Medicare goes on. Medicare Advantage plans are privately run alternatives to standard Medicare. That's what seniors don't understand when they're turning 65 and they're picking a plan. This most important line right here, I'll highlight it. Medicare Advantage plans are privately run alternatives to standard Medicare. It's not standard Medicare. It's an alternative to Medicare. When you sign your rights away and you go into the private health care plan, they then are responsible for taking care of all your decisions on what treatment you will get and what treatment you won't get and what you're going to pay, because it's a pay-as-you-go type system. Usually nothing or very small up front for a monthly premium, and then they get you when you actually have to go into the hospital or get treatments on a regular ongoing basis. Back to the story. Medicare Advantage plans are privately run alternatives to standard Medicare. The plans have been growing rapidly and now serve about 1 in 3 on Medicare, or about 20 million people. Pause right there for a second. If you offer a senior they've paid the most cost for health insurance at the age of 64, it's ungodly what 64-year-olds have to pay for health insurance. And it has been this historically, through this Obamacare Affordable Care Act thing. They've gotten hit the worst. And then you offer them an alternative. You can have a Medicare Supplement plan starting at around $100 a month, which supplements original Medicare, keeps all your freedom, your ability to go anywhere you want to, any doctor, any hospital, anywhere in the country. You and your doctor decide your treatment, but it's going to cost around $100 a month, depending on where you live. Or you can take this free, no cost, just sign here alternative, and we won't have original Medicare, but it'll be great. You'll get dental coverage, which is usually like 1 or 2 cleanings per year. You'll get a gym membership, which maybe 7% of the people actually use. You'll get all these special free things, a nurse line. You can call our nurses anytime. But you've got to read the small print, and that's where they get you. You get what you pay for. So let's run back into here. They've been growing rapidly. Sure, that's the decision to make. Either a cheap or free plan or one I have to pay for. And again, they've been compounded with these huge, horrible rates all the way up to age 64. Then 65 got to make that decision on which way to go. The Dr. Sewell case also alleges that the Florida health plans falsely represented that they had enough doctors, hospitals, and other medical services in order to justify an expansion of membership, a violation of government regulations. That's another challenge. In most of these plans that are managed care plans, the HMOs, you've got to pick a primary care doctor, which means that doctor is paid on capitation. However many patients they can take, that's how the doctor's paid. The more patients, the more pay. So many of the seniors that I know have had difficulty getting into the office in the first place because they're so jam-packed on their schedule to get in there. That's a problem. So you have to go through the primary care doctor. And by the way, if you go outside those rules and you just pick a doctor because your friend said he's a great one, guess how much they'll cover of that? If you pick a hospital, for a voluntary procedure that you have to have done, you've got time to think about it. You're not in the back of an ambulance, and you're going to think about it and go have something done somewhere that's out of network on a Medicare Advantage HMO. Guess how much they will cover for you? You can't fall back on Medicare. That's gone. You waive that right. It's gone. For that calendar year, you belong to an insurance company. And if you don't play by the rules, which means you pay a lot when you go in the hospital, that's if you play by the rules and everything's covered. If you don't play by the rules and you go outside of that and you do your own thing, you're going to pay 100% of the bill, and you can't fall back on Medicare for the 80% like you could on original Medicare, and then 20% paid by the supplement. Not if you waive your right and you go on these Advantage plans. So I digress. So they said falsely that they represented that they had enough doctors in hospitals. Under the settlement, Freedom Health and Optimum Healthcare will pay the government $16.7 million to resolve the allegations of risk adjustment fraud and $15 million for the alleged improper expansion of their territories. A group of Tampa area doctors founded the Optimum plan in 2004. I was there then, I remember that, which initially had only 3,000 members but later expanded. Freedom also began as a small plan of about 5,000 members in 2005, growing to more than 12,000 just 2 years later. In order to boost revenues, officials at the health plan allegedly directed auditors to scour patient medical records in search of new billing codes that could be added and submitted to Medicare. Yet Freedom and Optimum knew that as many as 80% of the added codes they submitted in some years were unsubstantiated, according to the suit. That was settled for big dollars. The suit also alleges that the health plans directed their doctors to call patients in for unnecessary office visits in order to find ways to raise their risk scores. These actions resulted in more than $40 million in Medicare overpayments during 2009 and 2010, according to the suit. $40 million. Let's jump up here and compare something real quick. Oh, they settled a suit for $32 million. But their actions resulted in more than $40 million in Medicare overpayments. Think the taxpayers got their money back? Think it was a good settlement for the taxpayer? That's an opinion. My opinion is that seniors need to look very, 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 very carefully at a Medicare Advantage plan when making a choice between Medicare Advantage or original Medicare. My best recommendation has been original Medicare. The freedom and the flexibility that you've earned your entire working life is Medicare. Best insurance known to man. 80% of legitimate bills are going to be paid. Now, if you go get acupuncture or you attend a voodoo doctor somewhere, that's not going to be paid. Legitimate bills we're talking about. 80% of the bill is going to be paid by Medicare that you earned and you're paying for on Part B. And then, this is where I help out, the Medicare Supplement plan, which supplements original Medicare, fills in the gaps and pays that other 20%. 80 plus 20, that's 100% coverage. And the flexibility and the freedom to go to any provider that accepts Medicare. Not a limited, confined, tiny health network of doctors in a small community that agreed to take you on as primary. Now, when you typically have a typical Medicare Advantage plan, that's an HMO plan, health maintenance, they're going to maintain you. They're going to maintain your organization for you. It's going to be a small group primarily. I've already said if you go outside the scope of what their doctors say, it's not covered. Go outside their network of hospitals, it's not covered. Most importantly, though, if you need a specialist, you have to go through your primary care doctor. He or she has to agree that you can go see a specialist. Then they have to write you a referral. That referral has to be somebody typically inside their small network. Can't be a good specialist, like a knee replacement orthopedic surgeon that you heard from a friend is the best in the whole county. Probably not. Because in many cases, they go to the lowest bidder on newer doctors. New to the country, new to medicine, lowest bidder, you get my drift. Not all the time, but sometimes that's what you're going to get when you try to put together a health plan and maintain and manage costs the cheapest possible way. So, again, my name is Christopher Westfall. I run the Senior Savings Network. You can find us online at seniorsavingsnetwork.org. Be happy to show you about the Medicare Supplement options that you have in the country, and we're nationwide. Just look at it as an alternative. Just get a second opinion, if you would, please, before signing your name away to a Medicare Advantage plan. Just want to give you a second opinion on what you're already looking at. And we can send you a document that's been very eye-opening for a lot of people about Medicare Advantage versus Medicare Supplements, and then the choice is yours. You know, so many times we have people call us when they're turning 65 and they say, I've been healthy my whole entire life. That's like having a brand new Camaro and having it for a year and say, this car has been absolutely phenomenal. Well, have that car for another 30 years and tell me what breaks down. Similarly, getting on Medicare up to for day one, yes, you're in great health. What typically happens on Medicare, in my experience with our thousands of clients now in 46 different states, is things start to break down, the warranty starts to void and get expired in your 60s into 70. 70 is kind of the peak point. Then in your 70s, you got to have some good health insurance to fall back on. I've told the story before. My grandmother was on a Medicare Advantage plan, starts with an H, ends with an A. She was in Arkansas. She got cancer. She went into the hospital for radical surgery in December. Bam, hit the maximum out of pocket. Major, major, major cost on that free plan. January came. Guess what? Infection, readmission to the hospital, bam, hit that maximum out of pocket again. You've got to read the small print on these cheap or affordable plans. So anyway, if you want a second opinion, it's something we can help you with. That's what I'm here for. Our service is completely free. We're paid by an insurance company. If you end up getting their product, we try to find the lowest possible price for the best possible quality product. I'm Chris Westfall. Thanks for watching. God bless you. Have a great day. Bye-bye.